Bismillahirrahmanirrahim. Today's lecture is about strabismus. It is also called squint, and it is also called bhangapan ya tirapan in Urdu. Definition of strabismus. Any misalignment of visual axis of both eyes is called squint. This is a very precise and simple definition, and examiners like it if you define squint in this way. Types of squint. There are broadly two types. Number one is concomitant squint and number two is non-concomitant squint. Few words about anatomy and physiology of ocular muscles. There are 6 extraocular muscles. 4 are recti and 2 are oblique muscles. Their actions are difficult to learn, but if one remembers the following few principles, then it is easy to learn. Number 1, obliques are abductors, vertical recti are adductors. Superior muscles intort, inferior muscles extort. This diagram shows various ocular movements. When the eye is moved laterally, it is called abduction. When it is moved medially, it is called adduction. When the eye is depressed, this is inferior movement, and when it is elevated, it is superior movement. When the 12 o'clock position rotates medially, this is internal rotation or intorsion. When the 12 o'clock position rotates towards the lateral side, then it is external rotation or extorsion. This diagram shows how to check the actions of various ocular muscles, in which position there is the maximum action of that muscle. So if we move the eye laterally, we check lateral rectus. If we move the eye medially, we check the medial rectus muscle. Now for obliques, we move the eye medially upwards and downwards. Why? When the eye is adducted, the long axis of the eye becomes in line with the axis of the obliques. And here only one action is possible, either elevation or depression. Inferior oblique elevates and superior oblique depresses. Likewise, when we want to check the actions of superior and inferior rectus, we have to rotate the eyeball outwards. When the eyeball is rotated outwards, its long axis becomes in line with the axis of vertical recti. And here only one action is possible, elevation or depression. Superior rectus elevates and inferior rectus depresses. Positions of gaze. The position of gaze may be primary. It is primary position when the patient looks straight ahead towards the horizon. Secondary position is when the patient looks straight up, straight down, left or right. Tertiary position is when the patient or the subject looks in oblique positions, like medially and upwards, medially and downwards, laterally and upwards, and laterally and downwards. There are 6 positions, cardinal positions of gaze. That is supromedial, medial, inframedial, infralateral, lateral, and superior lateral. Now a few terms used in the examination of squint patient. Agonist, it is a single eye muscle that moves the eye in any given direction. In the same eye, the muscle that moves against the agonist is called antagonist. For example, in right eye, lateral rectus, if the lateral rectus is agonist, its antagonist is medial rectus. Synergist, it is an ipsilateral helper muscle. For example, in elevation, superior rectus is helped by inferior oblique. Yoke muscles, these are pair of muscles in both eyes that move the eye in the same direction. For example, if we move the right eye medially, right medial rectus is paired with left lateral rectus. Now two important laws. Herring's law of equal innervation, which states that yoke muscles receive equal innervation. It means when the eye, right eye, is moved medially, the medial rectus of right eye receives same innervation that is received by lateral rectus of left eye. The other law is Sherrington's law of reciprocal innervation. It states that antagonists receive equal inhibition. It means that if one has right eye is to be moved outwards, lateral rectus is activated and medial rectus, its antagonist, is inhibited. Now the terms used for various ocular movements. When single eye is moved in any direction, these are called ductions. When both eyes are moved in the same direction, it is called version. And if both eyes are moved in opposite direction, that is convergence or divergence, this is called vergence. Binocular single vision. It is the mechanism by which humans perceive a single image from a pair of eyes, two eyes, and that imaginary eye is situated at the root of nose. It is one of the qualities in the humans that gives humans an edge over the rest of the animal kingdom. Nearly half of the brain tissue and half of the cranial nerves subserve the eyes. For binocular single vision to take place, it needs a perfect sensory motor coordination of two eyes. This is a diagram to show how brain perceives single binocular vision. So the brain perceives the vision as coming from a single eye situated at the root of nose. This is also called cyclopean eye. The main purpose of having straight eyes or non-squinting eyes is to have binocular single vision. What are the advantages? Obviously, seeing things as one, three-dimensional image perception, depth of field, estimation of objects in space, blind spot overlapping, enlargement of visual fields. This reflex develops within first 6 months of life. What are the requirements of binocular single vision? Number one, normal vision, that is eyes and afferent pathways, normal central coordination centers in the brain, and normal efferent pathways, that is the eyes that keep the eyes straight and there is no squint. Grades of binocular single vision. Number one is simultaneous perception. Number two, fusion. Number three, stereopsis. When this mechanism breaks down, there is number one, confusion. That is, one eye sees something else, one eye sees something else, and those two different things are superimposed upon each other. This results in confusion. Number two is diplopia. The same image is seen displaced because the eyes are not straight. And number three, there are adaptive mechanisms. Initially, the brain suppresses the image of one eye. But when the deviation remains permanent, the suppression leads to permanent depression of vision. This is called amblyopia. And the patient might adopt abnormal head postures to correct diplopia. This picture shows various grades of binocular single vision. Grade A is simultaneous perception. In this, the two eyes see different images which are combined in the brain. Grade B is fusion, in which two slightly dissimilar images or something missing in one image and something missing in the other, both are combined, and the one complete picture is seen by the individual. This is called fusion. And number three is stereopsis. That is, one eye sees from a different angle, the other eye sees from a different angle. And when they are combined in the brain, this gives a 3D perception of image. This is Worth 4-dot test to check for abnormalities of binocular single vision. The patient wears red-green goggles in which right eye has red goggles and left eye has green, and the patient sees 4 lights emitted by a torch. The lights are, there is one red on top, 2 horizontal green in the middle, and white below. So when the patient sees 2 red and 2 green, the patient has normal binocular single vision. If the patient sees 2 red lights, it means that the left eye is suppressed. That's why he is seeing only the white and red light. If the patient sees 3 green lights, it means that the patient is seeing through the left eye and the right eye is suppressed. And if the patient alternately sees 3 green or 2 red, it means that the patient has diplopia.